Hi everyone, it's Ginger here. This is over 2 weeks, 2 weeks plus 3 days, and the seroma is still here. It's actually spread, so kind of the square footage wise, it's actually bigger than it was because the drain kept getting clogged. And when it gets clogged, it can be the middle of the night, and then I wake up in the morning and now I've got new pockets of fluid. So, per a discussion with my surgeon, because I'm a PT, I can remove sutures. So she said, you know what, just take the drain out and see what happens. So that was interesting. Reaching way back to remove my own sutures, and then I had to coach my husband, who has never done that before, to remove the others. I am still upright, so it went fine. Anyway, the point is, ladies, if you are having trouble with your drain, those drains that are post-op, put in post-op, can be very skinny. When I took mine out, I figured this was the case, and I was right. When I did take the drain out, it was completely clogged with blood and tissue. There was nothing else that was going to come through that. There was no way to declog it. So it had to be removed regardless. Anyway, the fluid, when I did take it out, poured out. That's good. It has been just a day, actually, a little over a day since I did it. And things are going well. I want that incision to stay open so that I can continuously drain it. Every couple of hours, I am manually using physical therapy skills. I am manually draining the serous fluid from the open incision. It is actually more comfortable without the drain, but it is not comfortable to manually drain it. So you kind of have to work on your pain threshold and yogic breathing. That helps you knock it out, not a huge deal. So that's what's going on right now. Day 17-ish or so. I don't know how much longer the seroma wants to stick around. It just refuses to resolve. I'm doing everything that I can. Again, I'm still limiting my physical therapy that I'm doing. There's not a whole lot that I can do, push, pull, as much as I think that I want to. I really can't do that right now. I need to let that seroma close and those layers close so they stop filling with fluid. That's exciting, isn't it? But I am feeling positive. I am wearing the Jovi pack and the compression garment on top of that. It does not stop the seroma from filling, however. Would it be worse without it? Possibly. So I do recommend, doing that. That's important. I hope that these videos are finding their way to women, you guys who need this. You need encouragement to know that if you've got something this stubborn, it's all right. You're going to get through it. There's really nothing you could do to prevent it. It is not your fault. It's not the surgeon's fault, right? It just happens. It's one of those things. So you can get through it. If you have any specific questions, I am not an expert in this area. I am a women's health, pelvic orthopedic PT, not an oncology PT, but I know some really awesome people who know their stuff, and I am drawing from their words of wisdom and their recommendations. I'll be happy if you want to reach out, PM, DM, whatever they're called. It's called these days. I can't keep up with it on social media. I'll help direct you towards those resources that I know about and that I've been using and that have been helping me tremendously to be at least in a situation where I can feel positive about it and feel like, yeah, this is going to get better. So, update from the front lines. Hopefully I'll be back in a few days and say, hey, seroma gone, and I'm back to work. The interesting part is I have to go back to work this week, filming and seeing some patients. So keep me in your prayers for that. I don't want to do anything that I do to make this worse, but I'm self-employed. There's only so many weeks that I can stay out of work. So I'm back at it this week. Thank you for your prayers. Thank you for your support. And holy cow, the cards and stuff that I'm getting. My deepest gratitude and namaste to you all. Thank you.